Vanakkam. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center. On Sunday, I made a video about osteoporosis. I told you that bone loss has 6 causes and that the standard pill treats only one of them. The second cause on that list was vitamin D. Today, I want to take that one cause and follow it one layer deeper because vitamin D does something most people and even many orthopedic surgeons never speak about. You've always been told vitamin D is good for your bones. Drink milk, take a tablet, get some sun. But vitamin D is not only a bone vitamin, it is also a signal your cartilage cannot work without. Vitamin D does not just protect the bone beneath the joint, it switches on the cartilage above it. Vitamin D என்பது எலும்புக்கு மட்டும் இல்லை, மூட்டுக்கும் தான். And if you are preparing for a biological procedure like PRASAD, a level that is merely normal is often not enough. Inside your joints, your cartilage cells, called chondrocytes, work like tiny factories.
Let's journey inside the joint capsule. Passing the synovium, we enter the matrix. Here, chondrocytes maintain the cartilage integrity.
Their job is to build type 2 collagen and aggrecan, the shock absorbers of your knee. But these factories do not switch into construction mode on their own. They need a signal, and one of those signals is vitamin D. Every cartilage cell carries a vitamin D receptor, the VDR. When vitamin D binds to it, the cell shifts from simply surviving to actively building matrix. This is not a theory I invented. Studies on human cartilage cell show that vitamin D supports the building blocks of cartilage and helps protect collagen when the joint is inflamed. Without enough vitamin D, the factory stays in maintenance mode or worse, drifts into inflammation mode. Now, here is the part that matters most for PRASAD and other biological treatments. When we deliver biological signals into the joint, the growth factors from your own platelets, the messengers from your own fat, the concentrate from your own bone marrow, those signals must be received. Received by whom? By the very same cartilage cells we just spoke about. Your own chondrocytes. உங்க உடம்பு தான் வேலையை செய்யுது, வேற யாரும் இல்லை. This is how the biology actually works. Prasad does not replace your cells. It is not foreign tissue moving in. Prasad delivers the messengers. Your own resident cartilage cells do the rebuilding, and those resident cells need vitamin D switched on to read the messengers correctly. If vitamin D is low, the messengers arrive, but the factory is half shut. The signal lands, very little happens. When vitamin D is in the prepared range, the factory is powered. The signals are read. Construction begins. Vitamin D does one more thing inside an arthritic joint. There are enzymes in that joint called MMPs, matrix metalloproteinases. I call them the chainsaws of arthritis. They cut down your collagen. They speed up the wear. Adequate vitamin D helps calm the inflammation that drives those enzymes. It does not switch them off, but it takes some of the fuel away from them. And there is a real world signal that this matters. In the Framingham study, older patients, much like mine, those in the lowest two-thirds for vitamin D had their knee arthritis worsen about 3 times as fast as those in the top third over 8 years. Now, that is an observational finding, not a trial. I'm not telling you a pill of vitamin D will save your knee, but the direction is clear and it points the same way as the biology. So, vitamin D does two jobs at once, it powers the factory and it slows the chainsaw. That is why, before a biological procedure, we do not aim for just enough. We aim to prepare the whole environment. So, what level do we actually aim for? Let me be honest with you about this because it matters. 30 nanograms per milliliter is the basic level for bone health. That much is well established. But my patients are not young. Most of them, by the time they reach me, already have osteopenia or bone weakness or osteoporosis, thinning in the very bone that sits beneath the cartilage. I'm not preparing one tissue, I'm preparing the whole joint. And the foundation needs vitamin D as much as the surface does. Now I will be straight with you. There is no large randomized trial that proves one exact vitamin D level regrows cartilage. Anyone who tells you there is overstating it. What is true is this. Across regenerative medicine, the working target most physicians aim for is between 40 and 60 nanograms per milliliter. At MJRC, we aim for 50. Not because 50 is a magic number, but because we want the internal environment fully prepared with a buffer before we ask your cells to do difficult work. We call it PRASAD Ready. How we raise your level, the dosing, the cofactors is part of the pre-operative preparation, and I covered the full PRASAD orthobiologic treatment in a video on April 12th. The link is below. So before your next visit, look at your latest lab report and ask yourself one question. Are you normal or are you PRASAD ready? ஒவ்வொரு முழுக்கராக உங்கள் மூட்டை நாம் மறுபடியும் கட்டுவோம். I am Dr. A.K. Venkatachalam. Let us rebuild your joints, one molecule at a time. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center.